If you've been up late searching because your dog suddenly seems old, and every video or article you find makes it sound like the end, take a breath. Dogs age faster than our hearts are ready for, so normal changes can feel sudden and frightening. Slowing down is not the same as dying, and almost nobody explains the difference clearly. By the end of this video, you'll know exactly which changes are usually just age, and which few are worth a vet visit. Part of the fear comes from how we see change. Your dog is with you every day, so the little shifts can hide in plain sight until one morning they seem to appear all at once. The internet makes that worse. Farewell stories get attention, so worried owners find panic before they find context. Dogs also hide discomfort well, which leaves silence for your mind to fill in with the worst idea. A better way to look at it is this. Aging is usually slow, gradual, and often balanced across the body and behavior. Real trouble is often more sudden. That does not mean every slow change is harmless, and it does not mean every sudden change is a disaster. Only a veterinarian can tell you what is going on in your dog. Still, this simple pattern can give you a steadier place to stand. Dogs, like humans, go through a natural aging process with physical, behavior, and health changes. Common signs include lower energy, joint stiffness, changes in appetite, fading vision or hearing, and behavior changes like anxiety or disorientation. The American Kennel Club says lifespan varies a lot by breed, generally around 10 to 15 years, with small breeds often living longer than large breeds. A Chihuahua may live up to 20 years, while a Great Dane averages around 7. So if your dog seems to age too fast, breed size can be part of what you're seeing. First, the graying muzzle. You notice white hairs around the face, especially around the mouth and eyes, and your chest tightens because gray feels like a warning. This one is the easiest to say with confidence. Gray hair around the muzzle is cosmetic. It does not carry health meaning by itself. It can start surprisingly young, and by itself, it is not a sign that anything is failing. It is just fur changing color over time. This is where a lot of owners need permission to stop spiraling. A gray face is not a medical message. It is age showing up where you can see it. Next, sleeping more, and sleeping so deeply that your dog does not wake right away when you come in. This can be scary because it looks like withdrawal or decline. In many older dogs, it is normal to spend more of the day asleep. Lower energy is one of the most common signs of aging. If your dog does not stir when you walk in, fading hearing can be part of that too. It is usually not indifference. It is not your dog giving up. It can be an older dog resting hard in a quieter world until something stronger than your footsteps reaches them. The red flag is when sleepiness changes suddenly and comes with refusing food. That combination is worth a call to your vet because sudden lethargy with loss of appetite is not the same pattern as ordinary aging. Third, cloudy eyes. This one causes a huge amount of fear because owners see a blue-gray haze and think blindness is starting. Usually, in an older dog, that haze is nuclear sclerosis. That is a normal age change in the lens. It does not blind the dog, and it does not need treatment. It is not the same as a cataract. A cataract is a disease, and it does affect vision. Those two get confused all the time, and that confusion scares people who do not need to be scared. The honest answer is that you cannot sort that out by guessing from the couch or by looking at photos online. A vet needs to look and tell the difference. But the presence of that blue-gray look, by itself, often points to normal aging rather than crisis. Fourth, stiffness when getting up. You see your dog rise slowly, take a few careful steps, maybe hesitate before stairs, then seem to move better after a short time. That pattern fits age-related arthritis very well. Joint stiffness is one of the most common changes in older dogs. It is manageable, and it does not mean your dog is at the end of life. It means older joints need more time to warm up. What matters is the shape of the change. Slow to rise, then easing into movement, is very different from a sudden limp on one leg or dragging a paw. Those are red flags and worth a vet visit because sudden one-sided changes suggest something other than the slow wear of aging. Fifth, accidents in the house. This one hurts because it can feel like your dog is becoming someone else. A dog who was perfectly trained starts leaking urine or cannot hold it as long, and people sometimes take it personally. In an older dog, weakening bladder muscles can be part of aging. It is not spite. It is not your dog trying to make a point. It is not forgetting training in the way people often fear. But there is an important line here. If accidents start suddenly and you also notice heavy drinking or a change in the amount of urine, that is worth a vet visit. In older dogs, those changes can be a sign of kidney disease or diabetes. The age-related version tends to feel like a gradual loss of holding power. The red flag version changes fast and brings other changes with it. Sixth, confusion, staring at walls, or pacing at night. This is real. It is called canine cognitive dysfunction, and as of 2024, there is growing focus on it in older dogs. Research is still ongoing on the best ways to manage and treat it. For owners, what matters most is that aging brains can change behavior. An older dog may seem disoriented, restless after dark, or a little lost in familiar spaces. That can be part of the aging process, and it often creeps in over months, not overnight. Dr. Julie Busby said, "Understanding the signs of aging in dogs helps us improve their quality of life." That idea matters here because fear alone does not help your dog, but recognition does. The red flag is sudden onset. If confusion appears quickly instead of building slowly over time, that is a different pattern and worth a vet visit. Seventh, becoming clingy or drifting away. This is often the one that hits the hardest. Maybe your dog follows you from room to room now. Maybe they wait outside the bathroom door. Maybe they want to sleep pressed against your leg. Or maybe the opposite happens, and they seem more distant, less likely to come over, less tuned in. Both can happen with age. As hearing and sight fade, your dog's world can get quieter and dimmer. You become the thing they know best and can track most easily. If they shadow you, they are not being needy in some selfish way. They are orienting to the safest point they have. If they drift a little, it does not always mean they are emotionally leaving. Sometimes older dogs just interact differently because moving, hearing, and seeing all take more effort than they used to. The red flag here follows the same pattern as before. If a major behavior change comes on suddenly, rather than gradually, it is worth a vet visit. And this is the part many frightened owners need to hear most. Your dog is not leaving you. The world is just getting smaller, and they are moving closer to the center of it, which is you. Every gray hair and slow morning is proof of years you already got together. It is not a countdown written on their face. They are not giving up. They are taking longer to keep up and still choosing to keep up. There is a growing understanding of this in veterinary care. In the 2000s, research and awareness around canine aging started getting more attention. In 2016, the American Animal Hospital Association introduced guidelines that stressed regular wellness checks for senior dogs. In 2020, the American Veterinary Medical Association reported that 25% of pet owners took their dogs for veterinary care for age-related issues. That tells you two things at once. Owners are paying attention, which is good. And older dog changes are common enough that this is a normal part of veterinary care, not some rare emergency story. The American Pet Products Association says 67% of United States households, about 85 million families, own pets. A rising share of dogs in the pet population are seniors, 7 years and older. So if your dog is changing, you are not alone, and your dog is not unusual. Many owners report that with proper care, dogs can age gracefully and still enjoy life well into their senior years. There is also a healthy debate in the veterinary world. Some veterinarians warn that owners often mistake aging for illness and panic too fast. Others warn that brushing off changes as just old age can delay care. Both are right in part. The answer is not panic, and it is not denial. It is paying attention to the pattern and using your vet when the pattern changes. Dr. Elise Christensen put it well. As dogs age, they may not need less love and attention. They just need love and attention in different ways. That can mean more patience on stairs, softer beds, a slower walk, more mental stimulation, or just a little more time before they stand up. Research notes also point to regular mental stimulation and physical exercise, helping reduce the impact of aging. Not because they make a dog young again, but because they support quality of life in the body and brain your dog has now. So here is the shape of aging you can carry with you after this video. Slow, gradual, gentle, gray around the muzzle. More sleep, a blue-gray eye haze that is often nuclear sclerosis, not cataracts. Stiffness that eases after moving. House accidents that build slowly. Confusion that creeps in over months. Clinginess, or a little distance, as the senses fade and your presence matters even more. And here's the shape of the changes that are worth calling the vet about. Sleepiness with refusing food. A vet check to sort normal lens aging from cataracts. A sudden limp on one leg or dragging a paw. Accidents that start suddenly with heavy drinking or a change in urine amount. Confusion that appears quickly instead of slowly. Those are the moments to stop searching and make the call. That is what a veterinarian is for. Not the internet at 2 in the morning. Not a comment section. Not a video that treats every senior dog change like a final warning. Your dog is not definitely fine just because they are getting older. Only a veterinarian can tell you that. But your dog is also not dying just because they are slowing down, sleeping more, going gray, or staying a little closer to you. Your dog isn't dying. Your dog is getting old, and that means you still have time. So go use it.